Hi there. Today we are going to discuss another topic about a common diseases with dogs. What is canine parvovirus? Canine parvovirus or CPV is a highly contagious viral disease of dogs that commonly causes acute gastrointestinal illness in puppies. The disease most often strikes in pups between 6 and 20 weeks old, but older animals are sometimes also affected. Why and how might my dog become infected? Canine parvovirus can be found in almost any environment, but not every dog who comes into contact with the virus becomes infected. Several factors come into play in infection, including the immune status of the dog and the number of viruses the dog is exposed to. If the combination of factors is just right and a dog does become infected, a specific sequence of events has begun as the virus attacks the body. What happens during infection? Once a dog or puppy is infected, there is an incubation period of 3 to 7 days before the onset of first symptoms. Inside the dog, CPV needs the help of rapidly dividing cells in order to successfully cause disease, and the virus usually begins by attacking the tonsils or lymph nodes of the throat. Once inside the lymph nodes, the virus typically invades lymphocytes, a type of white blood cell that defend the immune system, as if you have an army of cells for your own protection, for 1 or 2 days, creating many copies of itself. The unaffected remaining lymphocytes will try to fight the infected ones. As a result, many of these CPV-infected lymphocytes are ultimately killed, causing a reduction in the number of circulating lymphocytes, a condition called lymphopenia. In short, the dog's defense army against infection is massively compromised. These changes in the blood cells can easily be seen by your veterinarian. Once in the bloodstream, the virus again targets rapidly dividing cells, hitting hardest in the bone marrow and in the cells that line the walls of the small intestine. In very young dogs, CPV can also infect the heart, leading to inflammation of heart muscle, poor function, and arrhythmias. The virus causes this destruction by targeting the epithelium of the small intestine, the lining that helps to absorb nutrients and provides a crucial barrier against fluid loss and bacterial invasion from the gut into the body. And that's why the infected dog will not be capable of absorbing the nutrients and possibly vomit the food intake during this phase. And because there is massive damage in the intestinal lining and no food intake, the dog will show signs of foul-smelling bloody diarrhea. What are the signs and symptoms? Because the dog's body is constantly battling the virus in many ways, and there's no nutrition being absorbed, you will see lethargy and depression. And remember, the gastrointestinal system is badly damaged, so there will be a loss or lack of appetite, followed by a sudden onset of high fever, vomiting, and diarrhea. How to test and diagnose CPV? The method that is being used nowadays is super easy. It's almost like a pregnancy test kit, except that your vet will need a fecal sample for the infected dog. It is called fecal ELISA test. CPV fecal ELISA tests can usually be completed by your veterinarian in less than 15 minutes. Though the ELISA test is fairly accurate, it can occasionally produce false positive or false negative results, so further testing may be necessary to confirm a diagnosis. A simple measure of white blood cell count is often the clincher for a CPV diagnosis. Because one of the first things the parvovirus infects is the bone marrow, a low white blood cell count can be suggestive of CPV infection. If a dog has both a positive ELISA reading and a low white blood cell count, a fairly confident diagnosis of CPV may be made. Now, let's go to the treatment options. Treatment for dogs suffering from CPV involves supportive care and management of symptoms. Treatment options will vary, depending on how sick the dog is, but certain aspects are considered vital for all patients. A hospital stay is often necessary so that the dog can receive intravenous fluids and nutrients to replace the vast quantities lost via vomiting and diarrhea. Antibiotics may be appropriate therapy to fight the secondary bacterial infection. Giving medications to control nausea and vomiting are sometimes useful. Now remember that the dog's intestine is badly damaged. The vet will opt to place a feeding tube to help and aid in nutrition. Blood transfusions may also be helpful to boost low blood cell counts that may result from CPV infecting the bone marrow and the possible effect of passive antibody transfer from another dog's plasma. Many dogs will respond to medical therapy if it is initiated in a timely fashion. And lastly, how do you prevent this? Those dogs that recover from CPV infection retain lifelong protective immunity against the strain that infected them. This infectious disease has become much less of a threat to dogs. This does not mean, however, that CPV does not remain a serious problem, and vaccination of your dog should not be considered an option. It is a must. Veterinarians usually administer the CPV vaccine as part of a combination shot which includes, among others, the distemper, canine adenovirus, and parainfluenza vaccines. You can also check the parvo immunity status of your dog by doing a titer test called VaxiCheck. We will discuss this test in the next explainer. And finally, parvovirus is extraordinarily hardy. They are capable of surviving for months outside an animal, even through the winter, and are resistant to most household cleaning products. Despite its relative resistance to cleaning agents, we do know that CPV can be inactivated by bleach. Cleaning with a solution of 1 part bleach mixed with approximately 30 parts water is an acceptable method for disinfecting any indoor area, including bedding, food, water bowls, and all surfaces that once housed an infected dog. There is evidence suggesting that CPV loses some of its ability to infect an animal after 1 month in an indoor environment. Outside, you cannot, and should not, bleach your lawn, but rain or watering can dilute the concentration of the virus over time. This dilution, combined with the sanitizing effects of sunlight, can bring the numbers of viruses down to an acceptable level in a few weeks. And that is another explainer video from me. I hope it gives you a bit of an information about canine parvovirus. On our next explainer, we will discuss all about the VaxiCheck antibody titer test. And here are my sources. Thank you so much.